Good afternoon. I'm Brent Rusin, Manitoba's Chief Provincial Public Health Officer. Today we are announcing no additional cases of COVID-19. Our total remains at 246. As of this morning, 9 individuals are hospitalized. Of that, 4 are in the ICU. The total number of COVID-19 related deaths in Manitoba remains at 4. As of this morning, 99 individuals are listed as recovered. There are 142 active cases. Public health investigations are continuing to confirm details, and information will be updated on the website as it is available. Yesterday, Cadham Provincial Lab performed 365 tests, bringing the total completed tests to 17,709. Again, caution Manitobans to not interpret these current case numbers to mean that our risk is reduced. We need to continue our efforts in our social distancing strategies to limit the spread of this virus. Certainly, this may indicate that our efforts are starting to show effect, but now is not the time to loosen up our struggles. Yesterday, I extended the current public health orders under the Public Health Act until April 28th. Extending these measures will continue to help us flatten the curve in Manitoba. Non-critical businesses can continue to operate where customers can order goods online or by telephone. However, customers cannot attend a business premises or property to order the goods. They can continue to sell goods to customers where those goods can be picked up on the curbside or delivered to customers. However, customers cannot pick up goods at business premises or on its property. They can also allow staff to attend a business premises without a limitation on the number of staff, as long as the staff take measures to keep social distancing of 1 or 2 meters apart from each other. They can also accept delivery of goods and may allow services such as construction repairs, maintenance, and cleaning to occur at these premises and on their property. We remind Manitobans that there should be no non-essential personal travel. Please cancel any non-essential travel plans outside of Manitoba. This virus is in every region in Manitoba, so Manitobans, no matter where you are, need to exercise caution, to stay home as much as you can, to practice physical distancing at all times, maintaining that 1 to 2 meters between everyone else, staying home when you're ill, frequent hand washing. A number of phone and online scams continue to circulate. The most recent involves Manitoba Hydro and claims your electricity will be cut off if you don't pay a bill immediately. This is not accurate. Manitoba Hydro has stopped disconnections for overdue accounts until further notice. Please hang up if you're contacted and call your local law enforcement agency. I want to ensure Manitobans continue to access credible information. Visit our website, manitoba.ca/COVID-19 for up-to-date information. With these recent trends and numbers, given our efforts to date, we can see that we are not helpless against this virus, that our actions can have an effect and are having an effect, but we must continue to focus. We must continue to practice social distancing, to stay home as much as we can, to wash our hands, to stay home when we're ill, even mild illness, and we'll continue to limit the transmission of this virus in our province. So I want to thank all Manitobans for your efforts, and we'll continue to work together to limit the transmission of COVID-19 here. So I'll pass it off to Lynette now.
Thank you. Good afternoon, everyone. I'm Lynette Siragusa from Shared Health. We know that most Manitobans are doing their part by staying home and flattening the curve. We also know that as the days go by, it can get a little bit monotonous. So with that in mind, I wanted to highlight a project that students at Red River College's Creative Communication program have been working on. Students in their public relations class were asked to come up with ways for Manitobans to fill the time, show gratitude, connect with others, and lower anxiety during this pandemic. They came up with some fantastic ideas, such as putting a teddy bear in your front window or posting one online to show your support for essential workers, decorating your mailbox to show support for postal workers and delivery drivers, encouraging people to participate in a 30-day challenge to better your life and improve your community, and also sharing and learning a skill. So these are fantastic ideas that will give families something to do in this time of social and physical distancing and allow us to feel better and get better. So thank you to these students for their efforts, and to their instructor, Melanie Lee Lockhart, for coming up with their assignment, and also to Ace Burpee for championing it. On to operational matters. So a couple of hours ago, the Premier announced that healthcare workers will be compensated if they need to self-isolate for 14 days due to possible exposure to the virus in the workplace, even if they are asymptomatic. So should a worker become symptomatic while isolating, they will be compensated with their sick leave benefits, which are detailed in their collective agreement. We have spoken before about the significant impact it can have on our operations and on our patients when staff members come to work ill. And that's part of the reason why we have put staff screening at entry to the workplace. And we know that staying home and self-isolating can be a challenge for some staff who may not have banked time, sick time, or vacation time. So on behalf of staff across Manitoba, we are really appreciative of this initiative. I want to let you know about a new assessment clinic that will be opening tomorrow at Sergeant Tommy Prince Place on Sinclair Avenue. This is a new clinic similar to the one that opened up last week at the St. James Centennial Pool. It offers primary care services to Winnipeggers who have tested positive for COVID-19 or who are experiencing respiratory symptoms that need to be seen in person. People should call their family physician or their primary care provider to determine if they need an appointment. And individuals across the province who need primary care are encouraged to continue to connect with their care providers and arrange for appropriate treatment options for their needs. And this may be a phone visit or a virtual visit, and it could be an in-person appointment or even a walk-in option. In addition to the Sergeant Tommy Prince Place, they will be offering a designated testing site for the virus, with resources now moving away from the Mount Carmel Clinic. So Mount Carmel Clinic will now return to its normal function of providing primary care services to the community. So hours for both the clinic and the testing site at Sergeant Tommy Prince Place will be 9 to 5, 7 days a week. And meanwhile, the community testing site in Brandon has completed its move to a new drive-through location. So this is at the Brandon Town Center off 8th Street on the P1 level of the parkade out of the old Canadian Blood Services doors. The relocated site should be open now, and its regular hours will be daily from 8 till 4 p.m. And for up-to-date information on our community screening sites throughout the province, you can go online to manitoba.ca/COVID-19. And I also just wanted to talk about the long-term care facilities for a moment, because that came up yesterday, and since the beginning of this pandemic, we have recognized that elderly residents living in these facilities face an elevated risk to their health. And we have seen some terrible effects of outbreaks in care homes, both in this country and around the world. So minimizing risk to residents of long-term care facilities has been a specific focus for us since we began working to respond to the threat of this virus in our community. So I have confirmed that throughout Manitoba, the staffing levels at the personal care homes do remain stable, and they are making sure that there are staff available to provide service to the residents in the home. And as well, I just remind you that a number of measures have been put into place in the last month, including restricted visitor access about a month ago, with exceptions being made only for compassionate reasons. We also suspended in-facility programs that brought large number of residents into one space and closed dining rooms to encourage social distancing. We have enhanced screening for staff to identify who is ill or symptomatic and ensure that they are allowed to go home and in many cases be tested. And we have increased education about the importance of hand washing and have directed staff to ensure that they're taking every precaution when providing direct care. We've also enhanced cleaning to ensure that sites are regularly wiped down and thoroughly cleaned, and we are testing any resident with respiratory symptoms for COVID-19. When a resident tests positive, they are immediately isolated from other residents at the facility. Contact tracing commences immediately to ensure anyone that has sustained close contact with that person who tested positive will also be isolated, and another deep clean of the site then occurs with an emphasis on areas where the patient and contacts were known to frequent. So we are very much focused on protecting the health of home care residents and are open to any new options that allow us to further minimize the risk of exposure to COVID-19. We're also working on implementing additional personal protective equipment across the sites this week and into next. So these are not easy measures, and we are trying to be careful to ensure that we have a proactive approach to managing this virus, but also have a little bit of room for compassion. And at every decision point, we need to take into consideration the safety and the health of our staff and our residents, with the important supports and human interaction that are also very necessary for this population. And finally, I just want to let you know of a new guideline that has been approved through our incident command, and it's regarding the food preparation and delivery. So the generosity of restaurants and businesses has been on full display this past month and very much appreciated by our staff and residents and patients when they receive it. So we want to thank everyone for their support. Working with the infection prevention and control experts, we've developed some guidelines to allow for these deliveries to continue, but still take precautions to prevent the spread of the virus. So going forward, we will no longer accept packaged food in cardboard boxes or styrofoam into our facilities. Food deliveries will need to be in plastic or other materials that can be wiped down with disinfectant wipe. And we ask that items be individually packaged wherever possible. Deliveries should follow social and physical distancing, and staff should be ensuring that any preparation or food handling that they're complying with hand hygiene. Again, we want to thank everyone for their support. Frontline staff really appreciate food donations, and these new guidelines are really meant to further reduce the risk of spreading the virus to patients, staff, and volunteers. The guidelines for the external food deliveries are available on our website or you can contact us at community@sharedhealthmb.ca. And with that, we can open up to questions.
Thank you. A reminder to our reporters online, one primary question and one follow-up. And please reintroduce yourselves. From the Brandon Sun, Bud.
Good day, Bud Robertson at the Brandon Sun. Honored to be the first question out there. For Dr. Rusin, we know of false positive results that have come back. Are you aware of any false negative results? And is this something that could be happening in Manitoba?
So the false negative rate on people who are symptomatic is likely low. Again, the testing for this condition is early, so we don't have a lot of evidence on that. It's one of the reasons why we don't test people without symptoms, because we feel the false negative rate is much increased in that population. So there's been on occasion a person who originally tests negative. They had very, very mild symptoms who later tests positive. Some of that can be considered a false negative result. Again, very rare. And so when we're looking at symptomatic individuals getting a negative test, we are relying on that in almost every circumstance.
Okay. My follow-up then is, recovered individuals, are they free to go ahead and give blood donations, or should they be waiting a certain more length of time?
So blood donations, that would, we would leave that up to Canadian Blood Services to decide those type of issues. Certainly, we're not seeing reinfection here. We haven't seen an example of that right now. In reinfection, we would consider people who have been recovered as immune right now until evidence would show us contrary. But I would leave a decision on blood donations to Canadian Blood Services.
From CJOB, Diana.
Good afternoon, Diana from 680 CJOB. Lynette, thank you for addressing the care homes question from yesterday. Today I've got a question on the need for testing. We are obviously seeing kind of newer, easier methods of testing, allowing for more widespread testing. What are the next steps in testing here in the weeks and months ahead? For example, if you're someone wondering if you might be asymptomatic but have the virus, will kind of all, most, many, or some Manitobans get tested for COVID-19? And if not, why not?
So for testing, we'll continue to ramp up our testing for the foreseeable future, and likely at any time we're going to be focusing our testing on symptomatic individuals. So again, what's driving this outbreak is symptomatic individuals with close, prolonged contact to them. That's what's driving the outbreak. So there's certainly some reports of pre-symptomatic or maybe asymptomatic transmission. That's not what's driving this outbreak. It's symptomatic people and close, prolonged contact with them. So we're going to keep expanding our testing criteria. There's a number of ways to do that. We want to keep our numbers up to ensure we're identifying cases early, so we can also isolate them and do contact investigation. But our numbers right now aren't indicating that there's a lot of cases out there that we're missing. Typically, we see a hospitalization rate of about 10%, and that's what we're seeing. And we're certainly testing everyone who's symptomatic in hospital, so we're not missing anybody there. Our positive test proportion is quite low, under 2%. So we definitely want to expand our testing, and we will. But right now, evidence is not really showing us that we're missing any hidden transmission.
And then just as a follow-up, with respect to the paid administrative leave for healthcare staff who need to self-isolate, will this be retroactive? I know previously employees had to use kind of sick days or vacation days to self-isolate. Will they get compensation? Like, will they get those days back?
Yeah, that's a good question, and certainly we just got word of that the same time you did, so we're going to take that away and work with HR, but I think that has potential, and once we confirm that, we'll get back to you.
From the Winnipeg Sun, Scott.
It's Scott Billick here from Winnipeg Sun. Just wondering, today you said that for Dr. Rusin, you said there's 142 active cases. I don't think anything changed from yesterday other than one more hospitalization. I'm just wondering if it's 142 or if it's still 143.
I think I had it came out originally as 143, and I believe it was corrected at 142. Some of these numbers are reconciled by surveillance over time, so we can double check that.
Sure. Okay. That's yeah. And then just in terms of the whole, I guess when it comes to these lower numbers, when we're like, so we're talking about 0 cases from what's reported on, I guess, yesterday. But when were those tests taken in, and does the low number of tests this past weekend, is that contributing to the low numbers right now? And are you expecting, I guess, more or higher rates of infection in the days ahead when testing ramps up again?
Yeah, so these tests would have been within the 24 to 48 hours. So that's the turnaround we're getting right now. Certainly the low test volumes are related to the holiday weekend. I imagine we had less turnout at our testing sites. The lower numbers, could certainly relate to lower test volumes, although we see this still quite low positive test proportion, which indicates that it's not only related to lower test volumes. So we'll continue to follow it. We're going to see in the days ahead if the test volumes were just a function of the holiday weekend. If so, then we're going to expand our testing criteria again to keep our numbers up.
From CBC Radio Canada, Ezra.
Hi, Ezra Belquizno, Radio Canada. I wanted to know if you could describe the situation in the alternate isolation center, please.
Sorry, what was the question? If we can describe.
In the alternate isolation.
Can you tell us a little bit about how it is going over there, if things are going good, and what are the plans to open the next isolation centers?
Yeah, so it is going good. So the first week was really about building up the staff, doing the training for the hotel, cleaning protocols, making sure that there was pathways and exercise opportunities. So that happened. They've been working with occupational health to identify positive staff or contacts of positive staff and offer the hotel option to isolate. And wasn't tons of uptake. So we're also working with public health to identify positive cases in their contacts, as well as Health Canada. So international travelers are still coming back to Manitoba. So there's the pull of those people if they don't have a place to isolate and they've been gone for a while, or they have at-risk people in their home, then we'll be offering that. So it's been going good. It's not as big a uptake as I was expecting, but I think word of mouth is getting out there. It certainly has been an appreciated option. And I think now that the protocols and processes are in place, then we can start to expand and share all those infection prevention and control protocols with the rest of the hotels throughout Manitoba and expand the option to other regions as well.
Okay, thanks. And is it possible to know how much people are how much health workers are working over there, and how much Manitobans are staying in those centers?
Yeah, so there's only 2 people right now working there, so they're receiving the referrals, they're setting up the people to be in the hotel, and I will get a number for you. They haven't been very high numbers though, but I will get that for you for tomorrow, okay?
From CBC Manitoba, Bart.
Bart Bekiza, CBC. Mr. Gusa, are you still allowing workers, the same worker, to work in multiple personal care homes, and if so, why?
So we are looking at that, and the only reason why would be because there's operational challenges to ensure that every site can maintain the services to the patient. So it's something that we are definitely encouraging and recommending, and work is underway to operationalize that right now. And I will also just let you know, oh, sorry, Bartley, but just to let you know that I've just been informed that the offer for the healthcare workers to get paid administrative leave will be retroactive to March 1st.
Oh, thank you for that. I have hopefully that doesn't use my follow-up. My follow-up questions for Dr. Rusin. Doctor, I know that you track the ethnic background of people who are infected. Do we have a First Nations case in Manitoba yet?
So we are working right now on those identifiers. When we have a solid identifier and a solid plan working with our First Nations partners, then we'll start communicating some of those numbers out. So at this point, we don't have anything to share.
From CTV Winnipeg, Michelle.
It's Michelle Gilway from CTV Winnipeg. Can you confirm any positive case clusters linked to any of the Manitoba cases? And how many there have been and how large are they?
Clusters.
So, yeah, I don't really have any detailed information on clusters to discuss. Certainly, as a matter of a contact investigation, we're going to trace contacts and follow them, and so certainly we know a significant proportion of our current cases are close contacts to cases. We did a bit of an analysis on our first 121 cases, and the first 121 cases had a total of 397 contacts. Of those contacts, 37 developed COVID-19, so that would give us what we call a secondary attack rate of 9%. So the proportion of those that were exposed that became ill.
Okay, thank you. Then this is for Lynette. Can you go over what home care services are being scaled back, and do you have any inclination as to how long that will last for?
Yeah, so the home care team has different priority services, so priority 1, 2, and 3, I believe, and priority 3 is what they're particularly looking at right now. So those are non-essential, well, they're all essential services, but they are things like just more hygiene, housekeeping kind of things that are done maybe on a less frequent basis. So things that would be like wound care or medication administration, those would keep going because our goal is to make sure that people can stay at home, are optimized at home, and we don't want any issues where they can't stay at home and have to come to the hospital because of service reductions. So it would be things that are more elective in nature, and they would all be assessed on a case-by-case basis. So if someone absolutely needed something, even if it was a level 3 and more elective in nature, then consideration would be given to that. So, and I do believe that, you know, it's kind of, I think they're looking at about a short term, like a week or two, just to replenish kind of the staffing. They want to look towards virtual visits as well, if possible. Again, just making sure that staff, the risk to staff is minimized, and yeah, so I think a week or two would be the goal, and only if it was able to be done safely and on a case-by-case basis.
From the Canadian Press, Steve.
Oh, hi, it's Steve Lambert from the Canadian Press. I've got a question on the testing. I know Dr. Rusin mentioned the numbers were down a bit yesterday and in previous days, likely because of the long weekend. Just want to double check. There is still no backlog at the Cadham lab, correct? These numbers are down solely because of demand and not because of capacity?
That's correct. On Friday and Sunday, the amount of submitted swabs were quite decreased compared to normal. So Saturday we still saw about, I think, 850 tests that were run. But there is no backlog at this point. The Cadham lab's working on that, about that 48-hour turnaround right now.
Okay, and we've seen in some other jurisdictions talk about reopening the economy, easing the restrictions gradually, releasing plans. Or the Saskatchewan government has talked about releasing a plan to reopen the economy gradually if the numbers stay low. And I just want your thoughts on that. If we have low numbers, some people are taking that as a sign that we may be over the hump.
Yep. So I think that the message right now is that our actions, Manitobans' work on this is probably working. That our low numbers are very likely a reflection of the efforts that Manitobans have been putting in. We know that if we let up on this now, we could see a reversal in this trend and start seeing these numbers climb. So it's important that we maintain the course right now, and reflect on our efforts and see that it's likely showing some benefit right now. But I think it's important to look forward is that it's very likely we're going to be dealing with this virus for the foreseeable future in one way or another. It's very unlikely that we'll be dealing with it in this restrictive of a manner. So I think it's there should be some look to the future, and even in the near future, where we may be able to very cautiously start rolling back some of these restrictions while watching our numbers very carefully. So what that specifically looks like and what the time frame is here now, it's a little early for me to say, but it's always in the works that what our exit plan is going to be.
From City News, Stephanie.
Hi there, Stephanie Lasuk with City News. We're getting some reports of racism faced by Manitoba healthcare workers, 1 in 5 who identified as having Asian heritage report facing racism in the workplace. I'm just wondering if you've heard about these concerns or what your reaction is to hearing about it.
I did just hear about it this morning, and it's very concerning. I would suggest and strongly recommend that if anybody is feeling any bullying or racism, that is not tolerated within the healthcare system. Every RHA has a workplace safety policy, and any issues should be escalated to your manager or human resource department to be dealt with, because it's not tolerated or acceptable.
And then the assessment center that opened last week at St. James, Assiniboia, can you just tell us what the uptake's been at that site so far?
I will have to get back to you because it's not sitting in front of me what the volumes are for that site. But we have them, so I will get them for you.
From the Winnipeg Free Press, Larry.
Larry Cush of the Winnipeg Free Press. Dr. Roussin, I'd just like to follow up a little bit on what Steve Lambert was asking. What specifically needs to happen before you could see an easing of restrictions? Would you have to see that active case number go down, or a certain number of days with no cases? What sorts of things that you would see that would trigger the easing of restrictions on our behavior?
Yeah, so there's a number of things in there, and you mentioned a number of them. So first is the trend. So one that we use is a number of days to double, and so we need to see that continually to climb or to at least plateau at a high rate. And then we want to see that the downward trend of active cases, as well as we want to ensure our hospital capacity remains able to cope with any increased amount. So we look at a number of things there: the time, the time to see these low cases as well. It's certainly nice to see a number of days like this, but it's really early to make that judgment now. But a week of this, and without any other indicators, then that's going to make us think of what sort of things could we do to ease some of the restrictions without compromising our gains.
And that was my follow-up. So what sorts of things might you ease first? Like what makes sense, what makes logical sense in terms of if you are going to start easing things, where do you start?
Yeah, and it's a good question, and there's some modeling going underway right now that's going to help guide some of that. We have work underway right now looking at various sectors. I think that probably the first area would be in the business restrictions, and which sectors could we loosen up on and how, and those are the type of things we're looking at right now.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. Just a clarification question for Ms. Siragusa. The Nurses Union is saying that nurses should be responsible to distribute PPE themselves. Is that something that the province would consider turning over distribution responsibilities to nurses?
I have not heard that before. Nurses distributing through the supply chain, is that what the question is?
Yes.
Well, I'm open to all conversations on that topic. That's a new one for me, but I'm not opposed to it. I just would have to learn a little bit more about what the goals of that would be.
And my second question is, the Prime Minister announced a new shipment of millions of N95 masks coming in. Do we know how that would impact Manitoba and our current supply situation?
No, but our government is in regular, constant conversation with the federal supply chain. So as soon as we get that information, then we will share that.
All right, reporters online, we have time for a few more questions. Please proceed.
Barbecue Victor, CBC Manitoba. I'm Dr. Reason. What percentage of our total caseload now, the total cases we've had, can you attribute to community transmission?
It is right now. So there's certainly a certain proportion of them that is still being investigated, but the number is in and around that 10% range. That so the vast majority are still related to, or the majority are related to travel, and then to direct contact with known cases, and then there's about that 10% that we can't attribute to either, and then there's a certain small percentage that's still being investigated.
Larry Cush of the Winnipeg Free Press. I have a question for Ms. Siragusa. Do you know currently how many healthcare staff are ill or in self-isolation?
I'm just getting that information. I will give you a more fulsome report tomorrow. The isolation we don't usually track because it ebbs and flows so regularly, but we do know the number of infected healthcare workers and which region they come from by profession, as well as recovered. So I'll provide that, as well as the number who have been tested tomorrow.
It's Michelle Gerwin from CTV. Dr. Wilson, wondering a little bit more about the assessment that you've done on the first so many cases. Did you learn anything else about where most cases were contracted? Is it people going out shopping or mostly travel?
Yeah, so in roughly about, it was about 53 to 55% were just directly related to travel. Another a little over 25% were related to direct contact with a known case. And then we had roughly that 10% that we couldn't attribute to either. And then there's always about another relatively small percentage that we're still investigating. So I don't have the better geographical breakdown right now of where those other contacts took place. Most of them were household.
Dr. Since Stephanie Lasuc with City News, just wondering if you do expect to see a spike in cases in about 7 to 10 days, which would follow from the holiday weekend of people who may not have social distanced during Easter and Passover.
Well, we're certainly looking for it. We're going to be following that closely, and it's going to guide some of our efforts going forward. I'm not sure I could say I expect it necessarily. We've had a number, our cases are still largely related to travel or to direct contact. So we're going to be watching that closely, and you're right, it's going to be about that 7 to 10 to 14 day mark where we might expect to see a spike if things didn't work well on the weekend.
Dr. Rusenberg, the chief here at CBC once more. At what point would Manitoba begin to administer some form of antibody test to determine who had the disease towards the later stage of this pandemic?
Yeah, it's still early. Research is moving on that, so there's still research to show whether those antibodies are neutralizing, whether they're effective, and then and then how we're going to utilize that. So one way is to do these seroprevalence studies to see exactly how much of the proportion, what proportion of the population may have been infected, to give us an idea of the asymptomatic rate of infection or mildly ill people who get this infection. And then it can be useful if in future waves or to know who is immune and who we don't need to concern about if they were another contact. So it's a lot of work is being done on that right now, and I think probably fairly soon we're going to be able to do this at least the research level.
Thank you.
Diana from 680 CJOB. Dr. Rusin mentioned yesterday that Manitoba has acquired the Spartan Cube. What's that looking like? I know you're testing them, you're validating them today. If that was successful, when could you possibly start rolling them out?
Yeah, so it's really early on. You're right, we have to validate this test. So even though it's approved, we still have to go through a rigorous validation process. And so that's really at more of a research stage right now. So as we get more knowledge on that and of the effectiveness, then we can look to do more widespread testing. The more of the shipment towards to Manitoba is we're expecting the larger numbers of that to be coming sort of mid-May with it. So right now it's early stages, it's validation, it's in the research stages, but we hope to be able to utilize that as another tool in the near future.
And how much could that increase testing by?
Well, it's because it's a point of care test. The test is rapid itself, but you can't run a number of tests at the same time. So it's not so much as the volume necessarily as to the utility of it in certain circumstances. So it's hard to know how much it'll increase our volume, but it's more the where we use it.
Thank you.
We have time for one more question. And that concludes today's media briefing.
Good, thank you.
Thank you.